webinar about complementary ways to manage your migraine. We're joined today by Dr. Susan Broner, who is the founder and medical director of the Manhattan Headache Center in New York City. She is also a voluntary assistant clinical professor of neurology at Mount Sinai Hospital. Dr. Broner, thank you for joining us today.
Oh, it's my pleasure to be here this evening. I wanted to speak tonight about complementary and alternative approaches in the treatment of migraine because many of my patients have expressed a great interest in alternative treatments for their headaches for a variety of reasons. Some have had unpleasant side effects from medications. They may have already been on medications but are seeking other methods that would enhance the gains they've already made. And some just simply don't want to take medications or can't take medications for other medical reasons. Hold on one moment. Just having a little, there we go. And tonight what I'm going to be talking about is the supplements used in migraine prevention, to learn about alternative treatments for migraine, including acupuncture, biofeedback, cognitive behavioral therapy, and some other techniques, and also understand about modifiable risk factors that are associated with worsening headaches, or what we call the chronification of migraines, and ways to address this. I'd first like to start with talking about supplementary treatments. And when in talking about supplements, it's important to understand that when you're trying supplements that they need to be given for a good 2 to 3 month trial. And in 2012, Holland and Silberstein and colleagues published in the journal Neurology some evidence-based guidelines for the treatment of migraine that included information about complementary treatments. And in reviewing the studies done on these supplements, they came to rank them, with the range being from effective to having insufficient data to comment on their efficacy. These are the supplements that were proposed for migraine treatment, and this analysis ranked them as follows. And we're going to be going into more detail about each supplement. Pitacides, or butterbur, was ranked as effective, with riboflavin, which is vitamin B2, magnesium, feverfew, and MIG-99, which I'll talk about shortly, as probably effective. Coenzyme Q10 was ranked as possibly effective, and omega-3 and hyperbaric oxygen had insufficient data to really talk about them. And when we're talking about effectiveness, we're talking about looking at the literature and seeing what studies have been done, and certainly there are limited studies in the literature, so that's important to keep in mind as well. Let's first look at pitacides, which is also known as, but it may block leukotrienes, which are inflammatory molecules thought to be associated with migraine. It also may act on calcium channels and affect vascular smooth muscle. In 2004, Lipton and colleagues published convincing data that pitacides is effective in reducing migraine frequency. They looked at 245 patients with migraine between the ages of 18 and 65 with at least 2 to 6 migraine attacks per month. And after using the supplement for 4 months, they found that the most effective dose was 75 milligrams twice a day, and that those people who responded had a 48% reduction in their migraine frequency. And that's actually a very significant number. When we look at prescription medications, the benchmark is often a reduction of headache frequency by 50%. And this is close to that, and some of those even had a greater response. Now, it's also important to talk about the safety of pitacides. Pitacides contains some liver toxicity and even liver failure resulting in transplantation. There may also be another component in it that's toxic. People are looking into whether sesquiterpene is a toxic substance within this plant. And up until 2012, there were 40 cases of reported liver toxicity, including 9 cases of acute hepatitis, 2 of those leading to liver transplantation. This data can be found in a consumer advisory from a United Kingdom registry of medicinal and herbal remedies. I think it's also important to note that many people have taken this, so the numbers are small, but it's certainly something to be aware of. We believe that the non-purified forms of the pediceides root contain these toxic substances. It's possible that some of the purified roots may be toxic, although we're still looking into that. The bottom line is if you're using the supplement, make sure you're only using purified brands and be aware that it's not risk-free. It's always important to tell your healthcare practitioners so that they can monitor liver enzyme function tests if you're choosing to take this herb. The next thing we should look at is vitamin B2, or ribophosphate metabolism in the metabolism in the brain contributes or has some contribution in generating migraine attacks, which is why maybe the mechanism of action for B2. In studies, it seems to be helpful in use showing significant reduction of migraine frequency using 400 milligrams of vitamin B2 daily. Interestingly, although it's often used in pediatric population and teen groups, studies did not support its use in these populations. Side effects can include some yellow discoloration of the urine, which is benign. Some people have reported some frequent urination or diarrhea, and some people find that it irritates their stomach, so taking it with food is usually recommended. So in terms of the overall recommendation of efficacy for this supplement, it's probably effective in preventing migraines of doses up to 400 milligrams a day in adults. Now, magnesium is also it's thought that magnesium deficiency may lead to excitation of neurons and aggravate migraines. Some studies have shown that cerebral cortex and cerebrospinal fluid levels of magnesium are significantly lower in people with migraine, both during a migraine attack and outside of an attack. But because serum levels reflect only a small percentage of magnesium in the body, blood tests may not pick up a deficiency affecting the brain and its metabolism. In terms of studies, there have been many studies done on magnesium intravenously, and one study looked at patients who had known ionized serum magnesium deficiency, and they seemed to respond quite well to IV magnesium in aborting an attack. And in another trial, in a placebo-controlled trial comparing magnesium to salt solution, which is really saline, those patients with aura, migraine aura, responded significantly. So patients with migraine without aura did not seem to have a significant response compared to placebo. However, so there seemed to be some benefit, even if not on pain. And women with menstrual migraine in studies also appear to benefit from magnesium supplementation. Magnesium can have side effects, the most common being softening of bowel movements and diarrhea. Some people can, again, may have particular benefit for those with aura or with menstrual. Now, a lot of my patients ask me about formulations, and magnesium comes in many formulations, including pills and powders. Your best bet is to purchase it at a health food store in one of these formulations. It seems that chelated magnesium is better tolerated, and magnesium glycinate is a form of chelated magnesium, uses it quite effectively. Magnesium citrate is also shown to be more bioavailable than magnesium oxide. It's probably a good bet if you're going to choose magnesium. Genes that are important in migraine pathways. There have been several randomized controlled studies that have showed conflicting data, and some showing benefit, some showing not quite enough benefit. And there was a meta-analysis done in 1998 that didn't support the use of feverfew. The challenges with some of these studies is that they used varying doses and varying preparations, and certainly on the market there are varying preparations and doses recommended for migraine prevention. There is a device, or MIG-99, is a stable extract, 147 patients, and they did not meet the endpoints of using this agent as a prophylactic agent for migraine prevention. But a follow-up study using MIG-99 looked at 170 patients using, there were some reports of some ulcerations of the mouth and used in these studies. So when it's purchased here in the United States, it's purchased as feverfew, and again, there is variability in the preparations, but it seems to be that doses of between 100 and 250 milligrams a day that are needed to be helpful. Let's turn to coenzyme Q10. Coenzyme Q10 and its role in migraine prevention. There were two main studies that showed coenzyme Q10 to be effective. One was at a dose of 300 milligrams a day, with those patients having significant gains compared to people taking a placebo pill. And another study found 150 milligrams of coenzyme Q10 taken daily for 3 months to be beneficial. And fewer attacks, fewer headache days overall, and less nausea. It seems as a standalone preventative agent, it may be beneficial, but it may not be very helpful as an addition to a multidisciplinary approach that's already in place. Side effects for coenzyme Q10 can include GI upset, and some skin allergies were rarely reported. So the overall recommendation for coenzyme Q10 is that it is, I included in my talk a slide on a herb called boswellia. It's not something that's well studied in migraine, and it was not discussed in the 2012 guidelines, but it's something I think we should keep our eye on. It's been shown to be beneficial in one small clinical trial in a treatment of a disorder called hemicrania, in which people respond to anti-inflammatory called indomethacin. And there are a number of headache disorders which are in treatment of these disorders with very few side effects at doses of 2 to 3 pills a day of 250 milligrams. There are not studies of this in migraine to date, but I'm hoping that in the future we'll see studies on this because of its low side effect profile. Stepping away from oral supplements, I'd like to talk now about about complementary treatments. There was a wonderful article in Current Treatment Options in Neurology in 2011, and authors Nicholson, Buse, and colleagues did a literature review of a number of complementary treatments to see what was effective, what wasn't, and they ranked these or rated them in terms of efficacy, of class 1 having the most evidence for being beneficial for headache prevention, and class 4 being the least beneficial according to the data that we have that it's available. That doesn't mean that some people haven't responded to some of these modalities, but in terms of literature evidence, there may not be as much evidence for class. Are we still? Huh? We're connected still?
Yes, I think we had a little bit of a
Looks
break. Are you there?
okay.
Okay, we're
Yes,
back.
I'm here. Let me back up. Did we get the acupuncture slide or?
I'm not sure. The last one I got was Don Buse's.
Here, this slide.
Yes, class 4 is where I left off for me.
Okay.
Sorry.
Got cut off there. Okay. So no, we're good. So then we just went, I just had gone over one slide, which was the acupuncture slide. So we're not too far off. So yeah, so acupuncture has been studied for quite some time. There have been many studies over the years. Randomized trials seem to show good benefit with about 50% responding, although there have been variations in some studies not showing it very effective. Some large studies, larger trials have been done comparing sham acupuncture to actual acupuncture. And interestingly, sham acupuncture did as well as actual acupuncture did, or I should say they performed equally. But if you compare them to placebo, both of them actually showed results compared to people who were on a wait list for either treatment arms, which means seems to show that something's working, some form of needling, and why that happened and why it's effective, we're not quite clear. But it seems to be a safe approach that has some good evidence for those who can't take or tolerate prescriptions, or for those who are looking for an add-in or stand-alone alternative treatment for migraine. I'd like to talk about biofeedback. It's been used for many years. It's given in a series of sessions. The patient is hooked up to a program that will digitally capture physiological responses and converts them into visual or auditory feedback for the patient to see what their physiologic responses are. This feedback allows the patient to regulate their responses, and there's very good evidence that supports that it's effective in both migraine and tension type headache prevention. There again are advantages to learning biofeedback. It gives patients a sense of self-control over their bodies and their headaches. It can be used preventatively and acutely, and the technique can be used also for stress reduction. Cognitive behavioral therapy is another therapy that has good evidence. This approach focuses on examining the relationships between thoughts, feelings, and behaviors related to generating stress. And because stress is such a common trigger, and learning how to deal with it and other ways of thinking about stress can be very helpful. It aims to identify unsupportive thinking habits and reduce stress responses. Advantages include that it's problem-focused, goal-directed, and aims to identify these unsupportive thinking habits and reduce stress responses. And there's strong evidence that it's effective. So it's deemed a class 1 approach in terms of migraine prevention. Other modalities, which I'm not going to go into in too much depth, include deep relaxation, reflexology, homeopathy, yoga, massage, and physical therapy. Deep relaxation is a technique that can be used to gain control and diffuse physiological response to stress. It lowers sympathetic arousal, and the sympathetic response, that's that fight or flight response that people get that can activate headaches and increase high blood pressure. And when practiced daily, there's good evidence that suggests that it is beneficial for migraines. Reflexology and homeopathy don't have much evidence behind them. There may be few studies as well. Yoga, again, there are a few studies, but it seems to have positive benefits, and it may help reduce stress and just enhance the sense of well-being overall. Massage always feels good for most people, although too deep a massage can sometimes be painful. But there is limited evidence, but one study showed some good benefit in reducing migraine frequency, improving sleep quality, reducing anxiety, and also creating an overall sense of well-being. Interestingly, physical therapy appears to be more effective than massage therapy, but seems to be most effective when it's combined with other activities like deep relaxation and exercise. So using it in a multidisciplinary approach seems to be helpful. And although it has weak evidence, it still may have a role if other comorbidities like neck pain or back pain are also present. I'd like to move to talking about modifiable risk factors. Migraines affect, just as a preface to this, I'd just like to review that migraines affect, certainly well over 10% of the population. We consider them to be a lifelong disorder, and most people with migraine have episodic migraine, meaning they're having, a few headache attacks, 2 or more per month, but 2% of Americans have chronic migraines. Those are folks who are having headaches 15 days per month or more for at least 3 months. So that's actually quite a large number. Marcelo Bigal and Richard Lipton have published many studies looking at migraine progression, so the progression of people going from episodic migraine to developing chronic migraine. And they published a paper in Headache in 2006 examining these risk factors. And they identified them, and I'd like to talk about how perhaps modifying these risk factors can prevent people from transforming from episodic to chronic migraine. These risk factors include obesity, acute medication overuse, so that's using the medications to abort a headache attack frequently. Stressful life events are a risk factor, as is depression, along with sleep disorders and caffeine overuse. So how can we address these? Well, exercise is beneficial for reducing weight and building your natural endorphins and also creating an overall sense of well-being along with stress reduction. Certainly with medications that you take as needed for headache, you want to limit them to 2 days a week or less, 3 days maximum if you're having a bad week. Limiting that can reduce your risk of converting to chronic migraine. In terms of stressful life events and depression, counseling is very important. Learning how, or not only counseling, but also perhaps using some of these other techniques like biofeedback and cognitive behavioral therapy can be helpful in adjunct to counseling. And treating sleep disorders, whether or not you're a poor sleeper or have a schedule that's not consistent, speaking to your physician or speaking to a sleep specialist may be beneficial. And lastly, caffeine overuse, trying to limit caffeine to no more than 8 ounces a day, or even going off caffeine for 3 months to see if that helps reduce your headache frequency may be beneficial. So just to summarize, we talked about effective supplements that may be beneficial. Pitacites seems to be the one that is ranked as effective, whereas riboflavin, magnesium, and feverfew are ranked as probably effective, with coenzyme Q10 being possibly effective. And I'm keeping an eye on boswellia extract to see where that's going. In terms of effective complementary treatments, acupuncture, cognitive behavioral therapy, and biofeedback seem to be very effective. And these other techniques like deep relaxation, yoga, and some of the other ones we talked about may also be helpful. And lastly, controlling risk factors that could convert you from episodic to chronic migraine is very important. Looking at these risk factors and addressing them to reduce your risk, along with your other treatments, may be very helpful in terms of minimizing your migraines. And that is the end of my presentation. I just wanted to thank you, and also when you're starting any of these, certainly speak to your headache specialist, healthcare practitioner when you're adopting any of these so they can help tailor them for you.
Thank you, Dr. Broner. It looks like we have a few questions. Our first question comes from Anne. What is your opinion on the Cephally device?
Great question. Hi, Anne. The Cephally device is, for those who don't know about it or haven't heard about it, it's a TENS unit, or an electrical unit that looks like a silver band that's placed across the forehead and worn for 20 minutes a day over a 3-month period. Clinical studies and trials in Europe have shown it to be effective for the prevention of migraine. The data, the studies to my eye look pretty good. The data was that 24% of people who tried the Cephally got significantly better, had a significant reduction in their migraine frequency, which doesn't sound like a large number, but the placebo rate, which is often very high in migraine treatments, was very low in the Cephally device. It was 4%. So I think it's an interesting and good alternative treatment. Some of my patients are beginning to adapt it and seeing it how it works for them.
Looks like our next question comes from David. Pure oxygen for migraine and cluster headaches. I've tried this for 15 minutes straight and found that it really does help. Is it safe to use, and are there any dangers that you are aware of?
That's a great question. So oxygen, in its use for stopping a cluster headache attack, is well documented. In its use for migraine, although people have reported that it helps them anecdotally, the data isn't very strong for using oxygen. Anybody with pulmonary disease should speak to their physician before starting oxygen therapy. So first of all, oxygen needs to be you have to have a prescription for it anyway, so it's important that you have healthy lung status, so you want to speak to your physician before starting it. But yes, it does have good efficacy for cluster headache.
Looks like it comes from Edith. What is your recommended dose of CoQ10?
I recommend 300 milligrams. Usually I have my patients start at 150 milligrams, and after 10 days or 2 weeks, I have them increase it up to 300 milligrams. And again, the supplements should be tested for a good 2 to 3 months, as long as you're not having side effects on them, to get the best benefit out of them.
Our next question comes from Nancy. Is the recommended dosage of MIG 99 6.25 milligrams for 3 times a day, or 100 to 250 milligrams a day?
Oh, that's a great question. Yeah, so that MIG data was just for that proprietary blend that was used in those clinical trials. So in the United States, you can purchase feverfew over the counter, and typically the doses range from 100 to 250 milligrams a day in various preparations.
Our next question is from Amy. I've had luck using oxygen with my daily intractable migraines. What do you know about that?
I think that's great if it's been effective for you. The studies on it don't seem to show that it's greatly beneficial. However, some patients do find it beneficial, and as long as it's safe for you, then it can be a good alternative treatment for aborting an attack.
All right, our next question comes from Susan. If I'm doing Botox, is it safe to also do acupuncture?
It is, but you don't want to do them on the same day. So if you're getting your Botox injections, you want to space out your acupuncture treatments, I would say a good couple of weeks before or after the injections. That's being on the very cautious side. Once Botox is injected, it's typically absorbed in 24 hours or so. So needling in those areas, I think, is your concern. You certainly wouldn't want to do it within the week week or two after. So you just want to space it apart, and you want to tell the person the physician or practitioner who's injecting you with Botox that you're getting acupuncture, so they can coordinate the timing between your acupuncture treatments and Botox. So basically, you want to talk to your healthcare practitioner, let them know that you're getting the acupuncture, have them work with you so that they can develop an appropriate time frame between the injections and your next acupuncture treatment.
Thank you. Our next question looks like it's from Kathy. The Chinese medicine is also using cupping therapy along with acupuncture. Do you have any statistics on cupping effectiveness?
No, I'm sorry, I don't.
We have a question from Edith. As a licensed massage therapist who also experiences migraine, I personally have received benefits from massage as well as found that my clients suffering from migraine receive benefits from massage. I would encourage migraine sufferers to explore massage therapy for their headaches through a licensed massage therapist. What are your thoughts?
Yeah, so when I was going over the data, let me just go back up to this slide. Even though it did not list it as having, it had a sort of low evidence for it, that doesn't mean that it's not beneficial for many people. So I think that there's a lot of studies that need to be done on massage. I know that I have many patients who do benefit from massage. And my advice for patients who want to get massage, I agree getting someone who is a licensed masseuse and who is attuned to your body. You want to make sure that what they're doing makes you feel good and that doesn't hurt or exacerbate the headache. So if you're getting a massage and the practitioner is going too deep or too light, certainly communicate with them. But in terms of its efficacy, I think we need more data on it, but I agree with Edith that many people do benefit from massage just in terms of their overall well-being, and some of my patients also report that when they have a massage, they've been able to break a migraine attack. I look forward to more studies on that.
Our next question is from Sherry. Is there any data on the chiropractic treatments and its effectiveness?
Yeah, so the Silberstein data on the first slide that I presented in 2012, I believe it was in that data, in looking at chiropractic, it does not seem to have good evidence behind it in terms of its efficacy for migraine prevention.
Thank you. Our next question comes from Jessica. Are there any problems of using supplements along with prescription preventative medications, such as Topamax?
Most of the supplements that we talked about today seem to not interfere with topiramate, but you want to always include the list of supplements that you're taking with your medication list when you're talking with your healthcare practitioner, because sometimes there are interactions with certain medications, and that's a very important question.
Our next question comes from Cara. Do you recommend trying one supplement at a time to determine effectiveness before trying the second supplement?
Yeah, so there's a number of different ways to try supplements. One is to add them in singly and wait and try them one at a time. And the advantage to that is that if you're having side effects, then from one supplement you'll be able to identify which supplement it is, be able to discontinue it, and then go on to another supplement. Um, some people feel like they want to try everything together, and there are combination supplements on the market that include most of those supplements that we talked about in one combination pill. And for patients who aren't particularly sensitive to vitamin supplements, then adding that in all at once and doing them all together can be an easy method of minimizing the total number of pills that you're taking today. So I think it's really a personal choice as to how your body responds to supplements, whether you're more of a sensitive person and more likely to get symptoms from it, then add them in one at a time. If you tend to have a solid gut and can tolerate supplements, then using one of these combined methods is a good alternative choice.
Our next question comes from Barbara.
Oh, but one thing you do want to do to okay. Oh, I just want to say one
Go
last
ahead.
thing to Kara is that it's important to give supplements a chance to work. So they really need to have a 2 to 3 month trial, and then if they're effective, then continue them longer unless you're having side effects. It's the same with the medications. They do need to give you need to give them time to see whether or not they're effective.
All right, our question from Barbara is related to magnesium. She wanted to know if she did hear you correctly in saying that magnesium causes bloating. She thinks that is her problem and wanted to know if you knew of maybe one that is better than the other for not causing bloating.
Yeah, you know, a whole host of stomach symptoms can come from magnesium. Most people tolerate it well, but I've seen some of my patients get bloating with magnesium. Diarrhea is a more common side effect. There's a quick way to find out if it's the magnesium causing it, which is to just stop it and be off it for a week. If the bloating persists, then speak to your healthcare provider to see if there's another cause of the bloating. Otherwise, it seems that the chelated forms of magnesium seem to be a little bit better tolerated in terms of their GI side effects. So if you think bloating is caused by the magnesium, give it a week's break, see if that resolves. If it doesn't resolve, see your healthcare practitioner to try to figure out what's causing the bloating. If the bloating does resolve, then it must be the magnesium, and maybe try a chelated formulation.
Our next question is from Linda. My migraines are often triggered by occipital migraines. Do you have any opinion on occipital nerve block and migraine prevention?
I'm sorry, her migraines are triggered by?
Your occipital migraine.
I'm sorry, we broke up. She has occipital migraine? Her headaches happen in the back of her head? Or?
Yes, that's what I believe. Yeah, it says my migraines are triggered by occipital migraines. Do you have any comment on occipital nerve block and migraine prevention?
In migraine treatment?
Yes.
Oh, okay. So occipital nerve block is a procedure that's in which a numbing medicine is injected just under the skin in the area of the occipital nerve, which is towards the back of the head, or located in the back of the head. Occipital nerve blocks are used to treat occipital neuralgia, which is inflammation of the occipital nerve, and they're also used to sometimes turn off a migraine attack that is persistent, that has been going on for several days. The data on occipital nerve blocks is variable. Sometimes it works. I tell my patients sometimes it works and sometimes it doesn't. But when it does work, it can be very effective. And it's fairly non-invasive, even though you're giving an injection. It's just right underneath the skin. I hope that answered the question for you.
Our next question. My neurologist wants to do a nerve block followed in a week by Botox. I have daily chronic migraine and I am disabled because of it. Is this a new way to treat chronic migraines?
Some headache specialists do intermix or give nerve blocks and Botox. There was but certainly not on the same time. There was a study done, I'm sorry, I don't remember the author. It was presented at one of the Headache Society meetings where patients were given nerve blocks year-round as a preventative that had some benefit. And some headache specialists do give nerve blocks in between Botox injections, particularly if the patient is fairly intractable and if nerve blocks have been helpful. So yes, some specialists do use that technique. They're just not typically given, they shouldn't be given on the same day. They're usually given, several weeks apart.
I'd like to thank you, Dr. Broner, for joining us this evening. You helped us kick off our Migraine Awareness Month, and I'd like to thank everyone for joining us as well. Looks like those are all the questions we're able to answer this evening. And I'd like to invite you all to join us next week.
Thanks very much.
Have a good day.
Bye-bye.